So, as a physical therapist, whenever we think about being connected and stable and strong in the saddle, one of the first things I look at on riders is their hip abductors and their hip AD or adductors on the inside. So, specifically for the hip abductors, I'm looking at that gluteus medius muscle that sits right about here on her. It's a deep gluteal muscle, so underneath the gluteus maximus. And in just normal standing, when that muscle activates, it's going to kick the leg out to the side or abduct the leg out. But when we're in the saddle and we're connected in our stirrups and our seat bones are sitting in that saddle, the real role of this muscle is to be strong to stabilize the pelvis, keep it nice and level in the saddle. So when we go to do aids like canter, changes, give a horse a little nudge with our heel, that pelvis stays stable and connected in the seat. The other thing I like to look at is the adductors are the opposite side, those muscles on the inside of her thigh, because when those tend to get tight on a person, they do what we call reciprocal inhibition or shut off our abductors or our gluteus medius. So we need to always check that these are nice and mobile and loose, so then these can actually activate in the saddle. And we'll look at that on the table. So first, I like to take a look at these adductors. I like to look at how they're moving, range of motion wise, side to side. I also like to come in and actually feel what's going on. There's multiple muscles that make up this group. See if there's any soft tissue or fascial restrictions that may be limiting that mobility or leading to shutting off that gluteus medius. Then I'll come over, go ahead and turn on your side. And the first thing I like to do with this gluteus medius or the hip abductors is really look at the strength of it, compare it side to side for symmetry and also how much they can activate. So when I first test this, I bring her into a position, externally rotate a little bit. I want you to hold it here. Don't let me push you down. And I'm going to look at how strong she is in the side as well as compared to her other side. If people are having trouble even lifting that leg or holding it, a lot of times what I'll come into the therapy session do is just teach them how to first activate or find that muscle and then give them some exercises to progress the strengthening so they can start to use it in the saddle better.